Some doctors recommend bioidentical hormonal treatment for women after menopause. What are your thoughts on this? Bioidentical hormonal treatment.
That is a hormone replacement therapy usually, and usually that hormone replacement therapies are not most recommended or even is expected out. And we as Ayurvedicians, we don't support that, because most of these hormone replacements definitely causes a lot of issues. There are occasions like when there is a prostate cancer, prostate has to be removed, then certain hormone has to be maintained. For that, there is hormone replacement therapy, or even a breast cancer or ovarian cancer. If very essentially we need to support by HRT, that is hormone replacement therapy, then there is no issue. Otherwise, for simple reasons, if you go for a bioidentical hormone supplement from outside, in a long run, they themselves cause a carcinogenic, and they themselves cause a lot of issues, and of course that should be avoided.
Yes, sir. And general trend I have seen in, especially in the US, is that young teenagers, when they attain menarche and in the initial few months to few years of their menstrual life, it is expected for them to have a little bit of a delayed menstruation or early menstruation. So initially it will be kind of irregular, and over a period of time it becomes regular. But the Western way of thinking in US and other countries is that if the periods are missing for 2 or 3 months, suddenly like hormone replacement therapy is the way to go. In a young age, replace. I mean, when there are natural measures available, and even the natural body, when it matures and when the body grows, the menstrual health also grows, and when there is a certainty that menstruation can be restored in a natural way, getting into hormonal therapy very early is not a very ideal situation. So.
Definitely, I don't recommend that in a very early stages going for a hormonal replacement just because 1 or 2 periods are missed and such type of thinking. It's not at all a good one. Only when I do come across a certain limitations in my practice, that many times young girls will come with severe dysmenorrhea, so I mean metrorrhagia. So in that condition, there will be severe bleeding, and I try to do with lot of medications. Many a times it will succeed in stopping the bleeding, but in few cases, it's very typically whatever the drug we use. It may be even Bolabhadrasa, Prataranta Kaloha, it may be Stiplon, it may be Pushanuga, what sort of else, but there will be no result. So in that time we can't wait, because bleeding is going on, and it is going to the girl will going to lose a lot of blood. So I cannot allow that to happen. So I suggest them, okay, go for hormones. Nothing, no issues. Only when there is no scope for any other drug, that can be taken. But it should not be in a very early, just 1 or 2 periods missed. For that, you just go for a hormone therapy. That should never be, because the body should be allowed to operate on its own, and it is a very good thing which rectifies by itself. It should be given scope to rectify.